Kia ora, I'm Chelsea Daniels, and this is The Front Page, a daily podcast presented by the New Zealand Herald. A major online security breach has raised questions about how safe our private information is online. Manage My Health's health portal systems were compromised over the new year, putting the data of over 120,000 users at risk. Later, we'll check in with internet security expert Black Veil's Adam Burns, who immediately identified flaws in the website, which isn't unusual for Kiwi domains. But first, on the front page, NZ Herald senior reporter David Fisher has been following the breach and will break down what happened and who is behind it. So, David, let's start at the beginning. What exactly happened in the Manage My Health breach, and what even is it?
So, Manage My Health is a patient health information database connection point where health services can upload, input information specific to an individual's account, a patient's account. I, for example, have a Manage My Health account. I get regular blood tests done, and the lab results, they get posted in the Manage My Health account for me to see them at the same time as the doctor does.
Right, and it's kind of one of those things where, like, if you need another prescription filled or something, you just log into Manage My Health and ask for another prescription, stuff like that.
The idea is that you automate everything, and some parts of the country don't have quite so much technology wrapped around their health services. Northland, for example, I suspect has been particularly hard hit because that's the case there. The idea is to collect all the information that a patient needs to know and that their medical professionals need to know in one place. And it's a widely used service too. Manage My Health on its landing page, on its web page, says it is trusted by 1.8 million New Zealanders to look after their health records.
Right, so this latest breach, tell me a little bit about it. How did it come about and how many people are potentially affected?
First sign of the breach was picked up by Manage My Health on December 30, and they realised or recognised that they had unauthorised access to their platform. That suspicion became concrete the day after, December 31, when Manage My Health received an email from somebody who had claimed they had a leak. They posted a sample of the documents that they claimed had been leaked to them on a site where these things are posted. And they said, we'll keep it quiet and the documents will never see the light of day if you give us $60,000 US.
What kind of information are we talking about here?
So the sort of information is quite specific, actually, and when you go to Manage My Health, there's a range of different menus that you can click on. For example, the lab results one, which I mentioned earlier for me, and prescriptions and so on. But there's also a part of the website which deals with clinical documents, and these are documents that are scanned and then uploaded onto the site. So this is the part that was hit. Manage My Health says it's about 6 to 7% of their users that were affected by this. That works out to be between 120,000 130,000 people in court filings to get the injunction to suppress the information. Manage My Health cited 127,000 people. So the type of information that gets scanned that you could find on there is clinical discharge summaries, referral notices to specialists. There could be historical referral records, information that patients have uploaded themselves that they want other medical specialists to see. It could also have diagnoses of your situation. It can have medical histories there, care plans, dates of birth, addresses, other personal information. If it is the case, as it is in the region of New Zealand that I live in, that your health services aren't particularly joined up in a technical sense, you're more likely to have uploads like that happen, where your medical professional will produce a letter that might be sent to you in the post, but they will also scan it and upload it into Manage My Health. That's the information that's been taken.
Yeah, and you mentioned that Northlanders are particularly badly hit.
Yeah, that's right. The thought is that it's about 85,000, I think, with a number of people in Northland that was said to be affected by this. That is a hugely disproportionate number, and I've not seen an explanation as to why that might be, but I do suspect that it is that gap in technology. Northland healthcare is it's stretched. It's very stretched, and it has been for a very long time. And it is hard for GPs to make a go of a surgery up here. It's hard for surgeries to get GPs to work at them, and a lot of the infrastructure is quite aged and quite dated. So, to my mind, that would lend itself to a scenario where more information was produced in hard copy and then uploaded, kind of like talking to your parents about how to do email stuff, where they will write up a letter on a computer, print it out, scan it, and then attach it to an email and send it to you.
Oh no, my mum takes photos of things and sends them to me.
Exactly, that kind of thing.
What do we know about this group or the people that are responsible for this hack, or say they're responsible for this hack?
So the person that individual that has claimed responsibility is an individual called Kazu, Kazu. That's a handle rather than a name. They say that they are an individual rather than a group, in that that handle is relatively new. It's only been in existence for the last 6 months, and I contacted the person claiming to be that hacker, interviewed them via Telegram, the social messaging app, and they had said that they had gone out on their own. Prior to that, they operated by a different handle, and by inference, were more a part of a collective back then. We do know that they have been involved in other hacks, or that they have been the recipient of hacked information in the past. They've said to me that they have received payments for that, and that it is a viable business model for them. That they look for health information as a particular thing that they do seek out, and having sought that out, they say that it's not unusual to then extract money as a result of having obtained that information.
Yeah, and when it comes to the money, do we have any idea if that 60,000 US has been paid out or not?
We don't know. We do know that Kazoo claimed to be in negotiations last week. I suspect that the time that was bought for negotiations was probably more in Manage My Health's favour for cybersecurity people to try and track down Kazoo, perhaps even our GCSB, who knows. But it's very often left unknown whether or not these payments are made, and there have been places in the past, not necessarily New Zealand, who have denied making payments, and then evidence has emerged later that they have done. These places are in a terrible bind. One of the things that was puzzling about the Kazoo hack was that the amount of money was seen as very small for the sort of information that was available. I'd talked to Kazoo about that, and what was relayed back to me was that that's part of the model. Don't make it too painful, make it easy. And as they'd said to me, they're only in it to make money. They don't want to create obstacles and barriers that are going to get between them and the cash that they're after.
It is a real catch-22, isn't it? Like the whole thing, do not negotiate with terrorists. So that's probably a pretty good reason as to why we don't say if we've paid or not, because then others around the world would be like, hang on, New Zealand's a place where they pay out pretty easily.
That's exactly right. And you become a target for further problems. And that's not the kind of attention that we want.
nothing is 100% secure. We are secure to the best of our knowledge, and we do all the professional tests which any industry assessment will make independently that we were a secure software. I'm a victim of the hack. My personal record is out there, right? And so is lots of my friends and families. I am deeply distressed that this is out there, and this has happened on software that our company has worked pretty hard to serve people.
In terms of Manage My Health has described itself as a victim of crime while also admitting that it did drop the ball. Where do you see the line between being a victim and being responsible?
Well, the victims here are Manage My Health's clients. They're the patients, the one that the information belonged to. Manage My Health has, in my view, created a situation where they have been whacked. The Privacy Act is pretty clear on this. If you look after people's information, you are responsible for creating an environment in which that information is going to be safe. So that is your job, and that was Manage My Health's job. They should have created an environment in which no hacker could get to that information. So look, I'm very sad and sorry for Manage My Health, but if Manage My Health was able to produce evidence that they had a Fort Knox-like security around patient information, then that sympathy that I have might be a little bit more than fleeting. But my sympathy is with the patients. It's with those people whose information has been obtained by others. And I've spoken to people who have lost, they believe, incredibly personal information, and really are having trouble getting through the day and sleeping at night as a result of it being out there.
So where do we go from here?
There's a government investigation underway as ordered by Minister of Health Simeon Brown, and there's also a Office of the Privacy Commissioner investigation underway as well that will be looking as to whether Manage My Health met its responsibilities under the Privacy Act. In terms of the investigation ordered by Simeon Brown, I would have thought that the Ministry of Health would have required Manage My Health to meet some pretty stringent security standards to be able to set up and run the business that they have set up and run. If those weren't part of the baseline expectation, and if there wasn't auditing around that, then I think that question does come back to the Ministry of Health as well. If we're going to allow a situation where private providers can step in and take hold of what has traditionally been a state job, then they've got to be held to really, really high standards, and we've got to make sure that they're audited to ensure that they stay at those high standards. So this business will have quite a way to run in terms of accountability, in terms of tracking down Kazoo. I think probably the same chance as a snowball on any of the days that we're having now. And for the patients and their private information, who knows? Kazoo has said that if the money gets paid, then that information will never be seen again. They do have a track record of that, but that track record is only 6 months long. The other thing about it too is that there's so much useful information in there to other people of Kazoo's ilk, other people who will find dates of birth or travel information, passport information, address information, all those personal indicators, they're incredibly, incredibly valuable because they can be used to leverage other exploits that can earn other people like Kazoo more money. So for those people, a very uncertain future. In an ideal situation, not that it is ideal, perhaps Manage My Health paid the money. Perhaps Kazoo did what Kazoo said they would do and deleted all the information, and that's the end of it. But those people that have been affected will not know that, and they can never really be sure. And that's a deeply, deeply unsettling thing for them.
Thanks for joining us, David.
Thank you, Chelsea.
After the breach, Adam Burns of security company Blackveil voluntarily tested the website and app and found flaws in both. He joins us now to break down what happened and what companies can do better to protect themselves and you. So, Adam, were there any warning signs or security gaps from your point of view when it comes to Manage My Health?
From the research that I did and posted in the blog, yes, there were some big gaps that should have been plugged a long time ago. These are basic fundamental DNS domain issues. So, yeah, there was a number of gaps that I would consider them to be required for any organization, but especially a health organization dealing with patient records and such.
And what kind of gaps? So you mentioned DNS?
Yeah, DNS stands for Domain Name System. So I'll just explain real quick what that is. When you visit a website on the internet, you type in a name like nzherald.co.nz. DNS server takes that name and converts it into an IP address. So that's where the server actually is. And yeah, DNS, essentially without DNS, the internet does not work. So you can see how important it is. And DNS also controls how traffic is directed to your website, how emails get to you, how users log in, log out, all of those sorts of things. So the gaps that I found are talking about mostly email security issues and domain and website security issues. So pretty key things to plug when you've got users logging into a health portal.
Yeah, and is that quite a common mistake or gap, I suppose, for websites in New Zealand?
Yeah, so I did a lot of research on this last year. I built a little app and stuck it on the .nz TLD. TLD stands for top level domain. I ran it for about 6 weeks, collected only maybe 2,500 domains worth of information, but over half of those domains had these exact problems. So it's not an uncommon issue. That is super common, and it is not just a New Zealand problem either. I've extended my research beyond that I've actually covered 51 countries now with the agent that I built. So yeah, it's a global problem. Have you heard Instagram got hacked today or yesterday?
No.
No? Okay. Instagram was hacked and 7 million user accounts were leaked onto the internet, like not the dark web. They were just leaked onto a forum. So I actually scanned them. I did the exact same scan on Instagram that I did on Manage My Health.
Yeah.
Similar stories. Instagram with billions of users, similar story.
And
Facebook,
same security gaps.
Yeah. These problems extend beyond small business into the 500, Fortune 500 realm.
Yeah, yeah.
Mm.
And so how can companies kind of rectify or, do better in that respect?
The first thing I would be doing is asking your IT provider, what are my current security gaps, and how can we best plug those? I have done my best to make that information as accessible as I can to people on my website. So people can go and scan their domains if they want to, and it will actually tell them exactly what I found with Manage My Health, the gaps, how to fix them, and the impact of not fixing them. Like, what is the main reason I should fix this hole? The scanner and the results will actually tell you that. And if you still need more help, I'm here, or you can speak to the agent Buck on our website. That also humanizes cybersecurity and technical speak.
In terms of what happened with Manage My Health and the kind of glaringly obvious, it seems, gaps in many websites in New Zealand's security systems, do you think that hackers worldwide who do this for monetary gain are looking at New Zealand at the minute being like, well, there's your cash grab?
Yeah, I mean, this time of year, New Zealand becomes a target just because of the Great Kiwi Shutdown. So I don't think we are much of a target until this time of year. And I've actually got data to prove that. So yeah, we're definitely the attacks on New Zealand and Australia ramp up from November to January. And now with this news breaking, I would say we'll be even more of a target now.
How do you make sure, if you do have your own personal information on the internet with a website, are there any ways to make sure that your information is actually safe?
The best thing that you can do to protect yourself is make sure that you've got multi-factor authentication on everything. So enter a password, then it will ask you for a code as well. Without the code, obviously, a hacker can't get into your account. They need the physical device that sends you those codes. So that is a good way to protect yourself. Other than that, you're at the mercy of the people's platform that you're using. So the best thing to do there is actually ask them, what are you doing to protect my information? What controls and regulations have you got in place that protect us? And what happens if there's a breach? How do you notify us? How quickly can you clean it up? All those sorts of things are things that people really should be thinking about when using such critical platforms, or any platform that you log into.
In terms of this breach, I'm wondering, because obviously we hear about breaches every now and again, you know, whether it's a banking app or a government app or something like that. Those are the ones that we hear about. Are those just the tip of the iceberg?
Yes, that is definitely just the tip of the iceberg. A lot of it goes unreported. Some of them are so small they're not worth mentioning in the news, but a small hack to the news might still be a big hack to a small business, for example. So yeah, there's plenty of hacks that we are not told about. Yeah, it's the Wild West. The internet was built, you know, in the 90s on trust, and if you look at the internet now, it's no longer a trustworthy place. So yeah, it's best to assume that your data is not safe and make sure that it is, especially with the introduction of AI. You know, if you think about the infrastructure that AI is currently running on was built 30 years ago. It's like trying to race a Ferrari around a go-kart track. That's how I would describe it. So yeah, I almost feel like we need an internet 2.0, but making that happen is virtually impossible, or a very, very slow process, because you'd have to do it. Yeah, I don't even know how you would achieve that. It would be very difficult. It's not impossible, but it would be very slow and very difficult.
Well, it seems like the horse is bolted in a lot of ways. Hey, I mean, I can imagine, you know, back in the 90s, what we would refer to as hackers were individuals going in and doing it one by one. Whereas now they can make quite sophisticated systems that do like, you know, 1,000 things at once or something. That's probably an understatement.
Yeah, I mean, even just in the last 12 months, hacking has become 1,000 times easier for people. If you think about how easy it is for someone to install ChatGPT and fill out an essay, for example, you can do the same with hacking. There's apps exactly like ChatGPT for launching spoofing and phishing campaigns. So what they actually can do is like a full reconnaissance mission on a business, so they can figure out who's the CFO, who's the CEO, who's the CTO, have they been mentioned in the news recently? What time of year is it? Have they mentioned they're going overseas? Those sorts of things. They do a full recon, and it's fully automated now. So it takes a lot of that manual effort away from the hackers. A lot of it used to be manual. Now it's all automated.
So where do we go to next? Is it just safe to have none of your personal information on the internet, or is that completely unavoidable?
It's pretty much unavoidable, right? We're kind of reliant on technology and the internet. You imagine if the internet was off for a day, the world would stop. So it's not like you can't stop using it. You have to keep using it. You just have to be super vigilant with protecting your credentials. Be very, very aware of the platforms that you're actually using. Maybe even see if there's more secure alternatives. And yeah, just be very, very suspicious of any links and emails. Like the best advice I can offer you for links and emails is hover over it. If the link you hover over doesn't look right, don't click on it.
Thanks for joining us, Adam.
No worries.
That's it for this episode of The Front Page. You can read more about today's stories and extensive news coverage at nzherald.co.nz. The Front Page is produced by Jane Yee and Richard Martin, who is also our editor. I'm Chelsea Daniels. Subscribe to The Front Page on iHeartRadio or wherever you get your podcasts, and tune in tomorrow for another look behind the headlines.